I think I'm comfortable going ahead with public comment before April gets here. Hopefully that will still afford her some time to join the discussion later on in the meeting if possible. So just to review, I guess, the rest of the agenda, my plan for tonight is after public comment, I'm going to ask our superintendent to give us a brief update, not a full presentation like last week, but basically an update of what has happened between last Tuesday and today. And then the board will discuss and entertain motions. I want to say there was also a couple of questions of why we were having this meeting, and I wanted to clear that up. First and foremost, it was requested by a board member. As you know, Ms. Manzelli had a prior work commitment last week that I was well aware of, and she was not able to move. And she requested that since she was not able to participate in those votes that we have meetings so she could do so. And further, and probably just as important, the current motion that the schools are operating under as far as the instructional model expires at the end of this week. We voted on being hybrid through Thanksgiving. So after school is out, well, I guess it is, I think today was the last day, there is no decision on what the learning model is. So we didn't come to any affirmative decision at the last meeting. And so we need to do that, or we don't have any direction at all. So that's why we're having a meeting tonight. So with that, Mr. Morris, I see you're co-host again tonight. If you want to look at hands, I'm going to try really hard to keep this as close to 10 minutes as we can. So again, if people don't mind being brief, that would be appreciated.
Okay, we have Karen Rusing is first.
Go ahead, Karen.
I'm hoping you guys can hear me okay.
Yes.
Okay, great. I'm going to try to make it short. I just wanted to know from each of the principals / headmasters, not necessarily who is a positive, but if we could have both numbers to help us make this decision to go hybrid from Thanksgiving, which I think, correct me if I'm wrong, is like November 30 to Martin Luther. If we could have the numbers of positives in each school and the numbers of the people who are students and or teachers that are quarantined for reasons like I have a runny nose or my coworker is ill and I got exposed. So if we could have those numbers, that might help us make the decision. I'm not 100% sure, but it might help. Thank you.
Thanks.
Okay, next is Brian Gleaton.
Go ahead, Brian.
Thanks, all. Real quickly, I just want to reiterate that since the last meeting, the governor has come out urging schools to stay open in some capacity, as well as Dr. Chan meeting with nurses and having conversations with them. Also, I urge the board, if Ms. Villani is unable to join, to hold off on voting to a further date, as we are now revoting again since Ms. Manzilli was not able to join last week. Thank you.
Thank you.
Next is Elizabeth Richards.
Hi, thank you so much. I'm Elizabeth Richards. I live on Jacks Drive in Pembroke. I have 2 kids, one in 2nd grade and one in 7th grade. And I was really bothered at the last school board meeting when April spoke and said that she had heard from taxpayers who felt that they were footing the bill and not getting what they were paying for. I do not believe that this is like Amazon, where I've ordered shoes and you've sent me a hairbrush. We pay our taxes and trust that the people who are running our schools make good decisions to provide a quality education to our children. I really believe that my kids are getting a high quality education to the best of the ability of the teachers and administrators, and that everyone is doing the best that they can to keep our kids safe. I do not believe that we should put people in positions where we ask them to share their expert opinions, our school nurses and teachers and principals, and then disregard those opinions. I think that we should be listening to the people who work in the buildings who are telling us this is not great and it's getting harder every day, and that we should be remote from Thanksgiving until the middle of January. Thank you.
Thank you.
Next is Steve and Tammy Boucher.
Go ahead.
Hi, this is Steve Boucher. I wrote to the board today to request that citizens have a vote at this, have a voice at this meeting, as that was originally not on the docket. And so I thank you for allowing this. Andy got back to me and he said that the majority of the people support fully remote education. And that might be because the people he's hearing from are people who support that, but the rest of us are frustrated and fed up at not being listened to. And what I'm finding is that the current board is kind of anti-choice. Children who want to remain remote currently have that option, but I'm wondering where the choice is for children who actually want to go in person. And where is the choice for parents who are forced with choosing to work or choosing to stay home with their children? So other communities are doing this really safely, so why not Pembroke? Thank you.
Thanks, Steve.
Next is Tori Barber.
Go ahead.
Hello, this is Tori Barber, president of the EAP, and I just want to restate and confirm that we stand by our statement of last week that we would support and encourage the board to go full remote to ensure a more consistent learning model for our students. Thank you.
Thank you.
Next is Karen, no last name.
Go ahead, Karen, no last name. Going once.
Is my hand still up, Andy? I'm sorry. I'll take it down.
Oh, was that Karen Roosing?
No, this is a different Karen. She's unmuted, but we can't hear her.
I'll take my hand down. Sorry, Dr. Morrow.
Okay. Well, let's move on, and then we can try Karen again at the end.
Okay, then it would be Deanna.
Go right ahead.
Hi, Deanna Dumont, Donna Drive. Gonna echo what Brian Gleaton said in regard to the governor encouraging the towns to resist going remote, and just that I continue to stand with what I have said in previous meetings and emails to you guys, and I'll say on my husband's behalf as well that he is in the same position as well. Thank you.
Thank you.
Next we have Casey.
Hi, I know I spoke last meeting. I just want to reiterate exactly what Elizabeth had said. I understand people being frustrated with remote learning as well as hybrid. Just please, for the board's sake, please keep in mind that these are teachers that have families as well as the administrators. They have families. Think of their safety as well. It's a hard thing. You guys have to make a choice tonight, but please just keep the teachers and all the administrators in your thoughts making this choice. Thank you.
Thank you.
You want to try Karen again?
Sure.
Okay.
Hi, can you hear me?
Yep.
Hi, it's Karen Yeton. Just a quick comment. I just wanted to remind the board that back in August, this board expressed some concerns about lack of guidance from the governor on school reopening. And yet today, the governor has been very clear, encouraging our local schools to resist return to all remote. And the reason for that is because we do not have outbreaks in our schools in New Hampshire. And I want to remind the board that you are obligated to listen and consider the needs of your primary stakeholders, and that being your parents and your students, and not our teachers' unions. That's for the SAU to manage. School board should be focused on parents and students. And the parents has been telling this board for the last 8 months now that remote education is not working for them or their children. And I'm seeing little acknowledgement to address that or to provide viable solutions to remote for those parents. Remote education unequally benefits very privileged families that have the resources to support it, and the children who are predisposed to learn well within it, which very few elementary school children are. And I remind this board again that you are obligated to ensure equal and fair distribution of education to every child in this district, and remote education is not doing that. This board must start acknowledging the scientific data in its decision-making. COVID mortality rate amongst children is extremely rare, 83 out of a population of 60 million. That's statistically improbable that a child in this community is going to perish from COVID-19. And yet all the other children are being affected very negatively in their education as a result of that decision. So I encourage this board again to listen to parents, listen to what the federal and state health experts are saying, and stop using school nurses and teachers union and unfounded personal fear as your primary consultants for designing COVID policies for our district. Thank you.
Thank you. Any other hands?
Yeah, we have three. Mark Dumont.
Go ahead, Mark.
Can you hear me?
Yes, sir.
Hi, Mark Dumont, Donna Drive. You already had heard from my wife. So we really don't know what's going to happen with COVID, but we know the schools are handling it really well. We also know remote's not working. So we need to get the kids as much exposure to the teachers face to face while things are still going good. I know that infections are going up, but the schools are handling it well. We don't know in 8, 12 weeks what it's going to be, but right now it's good. So we need to stay open while we can. In fact, I think we need to open up 5 days a week. If we hit a rough patch, by all means, the board we can do an emergency meeting and then we can close the schools down. But for the betterment of the children, while it's being proven right now that teachers in the community are safe still with children going back to school, we need to ramp it up, not do the opposite. If we run into a rough patch, by all means, and I mean, if we have a super spreader event, not 1 or 2 infections, like it's showing, like when they get the kids out of school, that they're not giving it to each other in the school, and there's no instance of a super spreader event. We need to go in the opposite way and open up fully. We got to get these kids as much schooling as possible because things are going good, and look at Hooksett. They're proving it every day. They'll miss 1 or 2 days when there's an infection, but there's no super spreader events going on. We need to get these kids their education. Thank you.
Thank you. Mr. Morris, let's take whatever hands are raised at the moment and then move on to the phones, and then we'll wrap up.
Okay, we have 4 hands up. Tammy Sanjan.
Go ahead, Tammy. Tammy, can you hear us? All right, let's move to the next one.
Sorry.
Oh,
I got it. Sorry about that. I couldn't, it wouldn't unmute. Sorry about that. So I've just been listening to what people are saying, and I empathize with everything that people are going through, and the teachers empathize with everything people are going through, and we understand how hard this is on families. And personally, I am somebody in the trenches, and remote is not my favorite thing to do. It's actually very difficult, especially small children. However, having said that, our numbers are going up, and they are going up steadily across the country. And regardless of what the governor says, you have to look at the numbers that are happening in our town and in our school. So part of the problem is people are not being forthcoming with leaving, or who they've been around, or who they've been exposed to, because, and we are finding out these things, and that is putting your children at risk. And it is also putting staff at risk. And the person who said stakeholders are children and parents, the staff is also stakeholders. Like we do have our own health issues, and we have family that has health issues. This does impact us just as much as it impacts you, and just as much as it impacts your students. And the New Hampshire School Board Association states that the number one responsibility of the school board is to take care of the students. That is their education, but that also includes their safety as well. And as far as people continuously to state the education RSA, it does also say under policy and purposes that school districts have the responsibility and flexibility in implementing diverse educational approaches to instruction and curriculum tailored to meet student needs. And due to the pandemic, safety should be the number one priority. I mean, again, I understand people have to work and childcare issues, and remote is not, the preferred way of delivering education. But, the fact of the matter is we are in the middle of a pandemic, and people do travel, and people are not being forthcoming with what they are doing, and it's putting everybody at risk. So, and these cases are increasing.
I gotta have you wrap it up, Tammy.
Yep. Okay, that's it. That's all I just want to state.
Thank you.
Okay, thank you. Sorry about that.
No problem.
Rebecca DeGrave.
Go ahead.
Good evening. I just want to say that I am a parent, and my child is a student, which I guess makes us stakeholders. In response to the child mortality rate associated with COVID, I personally don't want my child to be one of the quote unquote small population of children who may perish from COVID. Safety and health is most important to me. Thank you.
Thank you. Got one more.
Two more. We have Kyle Noel, and then Melanie Camello was the last hand before you wanted to
Go ahead.
off.
Go ahead, Kyle. Kyle, you're still muted. One moment.
Hear me? Can everybody hear me?
There you go. Yep.
All right. I just wanted to go over some numbers here that I've got straight from CDC. Basically, everyone from 5 years old up to 64 years old, we are talking 0.00683% of the population. 85 and up, we're at 1%. Now, again, I don't want to even go there. I've got two kids that are in the school, and I don't think any of us that want to go back are suggesting that we want to put anybody's kids at danger or risk. But at basically these percentages per the CDC, we all have more chance of getting hurt driving to school or going on the bus than we do actually contracting COVID and putting our kids at risk. So I'm a small business owner. If my truck's on the road, I'm not making any money. To see these numbers and to say that we're putting anybody at danger within this range, if you guys tell me that the majority of the school is 85 years and older for the staff, and it was 1%, I'd be right there with you for closing down. But at these numbers per the CDC, I cannot see how any of you would want to vote not to put our kids back in school. Thank you very much.
Thanks, Kyle. And we've got one more. I forgot the name. Sorry.
That is Melanie Camello.
Go ahead, Melanie.
Hi, thank you. I just want to reiterate everything that I said at the last meeting. And I did want to address the board and say, please, by any means, don't think that parents who are choosing remote learning are doing it because they're privileged and it's the easy way out. My kids are remote learning, and it is not conducive to a learning environment. It is really hard work, and we're living off unemployment because my child is one of those kids that this virus could kill her. I trust the schools. Those school nurses are doing a really good job. But we can't trust our community when this is a small town and you know somebody's supposed to be quarantining and they're walking through Sully's. So I can't send my children to school because the whole town is not doing the right thing. Our school nurses are doing a great job. The school may not be a super spreader event, but we are certainly spreading it in our community and putting those that are high risk in risk at our schools. And I've already watched my kid live on a ventilator for 99 days, and I hope nobody else ever has to live through that. Thank you.
Thanks, Melanie. Okay, so Dan, you don't have to unmute the phones anymore, right? They do that themselves?
That's correct.
Okay, so if you are called in, and there's a lot of you, So I do want to keep this as brief as we can. I know I already said that a long time ago, but I want to give people an opportunity. So if you're on the phone, I think you can hit *6 and that will unmute you. So if you'd like to contribute to public comment, please hit *6 and state your name. The first one I hear, I will recognize, and then I will move on the list. I see there's a couple unmuted already. So if you want to state your name.
Lauren Dwyer, 4th Range Road.
Go ahead, Lauren.
Hi, just want to echo pretty much what everybody else is saying, what Melanie is talking about. I like what Tammy had to say. You guys are working really hard. You're in front of a Dunkin' Donuts right now. I appreciate everything you guys are doing. And please continue to look at the science, listen to our nurses. I know 3 children in our community, in our town, where they would not survive if they catch this thing. You know, my daughter, she'll be okay, but I don't want her friends to pass away, and I don't want her to live with that, and I don't think any of us want to live with that. So I know it's hard. It's really hard, but I urge you to just look at the science and listen to our nurses and our superintendent and our staff. That is all. Thank you.
Thank you. I think I see one other phone line unmuted. Couple. Go ahead and state your name if you'd like to contribute.
Hello, my name's Jody Moore. Can you hear me?
Go ahead, Jody. Yep.
Hello. I have a daughter over at PA. I serve on the Allenstown School Board, and you know, I can certainly attest to the fact that since last week's meeting, I have received a call or notification from Pembroke Academy every single day, if not twice a day, of another COVID case. I do feel that I'm a nurse myself and I understand the science and clinical background. However, I understand that in our community, our very small community, these numbers are rising. And unfortunately, we cannot sit back and wait. We need to act to be able to stop this from spreading. Now, although the statistics and mortality rate is low, I feel like no chance. We should be taking absolutely no chances. But on the flip side of that, what people don't understand is that it's children going to school. They're bringing this virus home to their loved ones. Their loved ones are at risk. It is not the students at risk. It is the loved ones at risk. It is the high-risk community that we need to act on behalf of. Thank you.
Thank you. Anybody else on the phone?
Melinda Freen.
Go ahead, Melinda.
So first of all, thank you to the board again. This is such a hard time. I can't imagine being in your position. And I think no matter what, there's going to be people unhappy today with whatever decision you make. But I want to point out that I do not think Pembroke is doing poor with remote learning. Families may be experiencing difficulties on remote pieces when people are constantly switching between models, when they're hybrid and then remote for a week. But that does not provide teachers and other support professionals the time to adequately prepare. My children are in the remote model and they are thriving right now. So I kudos to that team, but I think if we keep flip-flopping, those who are in the hybrid model are actually going to suffer because the teachers can't get ahead. Thank you.
Thanks. Anybody else on the phone? All right, so we did not hit 10 minutes, but that's okay. Good to hear from everybody. Thank you all for joining us and being involved. We're going to move on. I'm still hoping that April is going to be able to join us at some point, but for now I'm going to ask our superintendent to give us a brief update of where we've gone since we met a week ago.
Sure, thank you. So at Hill School, these are additional numbers from just last Tuesday. I'll just go through the list. We, at this point, are nearing the 20% student attendance, student absence. The staff being out has increased dramatically on a daily basis. And as a matter of fact, today we were almost unable to provide enough coverage to open the school. Just last Tuesday, I spoke to you about students who had come to school ill. The very next day, Wednesday, we had a student come in who was sick and commented that she had been told by a parent that she would probably be sent home. We have an average of 50% of our families completing the screening survey in the morning. We have an increase in the students needing to be placed in isolation, which means our nurse has to be in isolation with those students and is not available for the rest of the school. Our quarantine list has increased greatly, and it's not, again, people keep talking about the spread or in school, and that's not what we're talking about. We're talking about mostly quarantines. Yes, we have a rise in cases, but it's also the quarantines that are impacting us. So at this point, we have 17 additional students quarantined and 2 being tested who are ill. We have 2 staff that have been sent for testing. We have an additional 6 staff who have been quarantined. One staff member is positive. Our preschool had to shut down. And we are also dealing with the other typical absences from staff members. So this is an issue of us, like I've said in the past, every single night and every single morning trying to figure out if we have enough staff to open our buildings. At Three Rivers School, we've had additional 3 staff quarantined and another 17 students quarantined. And today, just as an example, we managed to cover, but it was very strained in terms of coverage. People are being pulled from places they shouldn't be pulled from to provide that coverage. At Pembroke Academy, we have, actually I had a conversation with Dan a couple of hours ago, so I won't include that in my numbers right now because he's still working on something. But as of earlier today, we had 3 staff members test positive and 5 students. We have 41 staff members quarantined and 42 students quarantined. So those are the numbers that are greatly impacting my recommendation. Just taking the pandemic and the spread and what's going on in our schools out of it, because I think we have done an absolutely amazing job and we've put a lot of measures in place, but we don't have control over who is exposed, where they're exposed, and they are told by DHHS, the Department of Health, that they have to quarantine and for how long they have to quarantine, and we have to abide by that. So that those things are not things that are within our control, unfortunately. And those are the updates that I have for you. And I'm sure if you have any other questions, our principals can answer them as well.
Thank you. I would like at this time to ask Amy Manzelli if there's any, since she missed the discussion last week, if she feels that she is, I guess, up to speed on the current situation, or if she has any particular questions so that she can be up to speed.
Thanks, Andy. I appreciate that. Again, I apologize that I had a pre-existing conflict for the meeting last week and that the meeting couldn't be rescheduled. Since, excuse me, since that meeting, I have watched the entire meeting. It was great to be able to have that capacity, and I usually attend the meetings in person, so I didn't realize that those are posted so quickly right afterwards, so that was good. I've also reviewed as a board. We've received a large number of emails. I have read all of those. Some of those emails included attachments such as a document from CHAD, Children's Hospital at Dartmouth, and articles about the governor's advice about urging schools to stay open in certain circumstances. And so I feel like I am up to speed at this point, but I appreciate the opportunity to ask follow-up questions. I'd like to make a motion tonight that we go to remote instruction starting on Monday, 11:30 through Friday, January 15th, 2021.
All right, is there a second for discussion?
Second.
Is that Eugene?
Yep, second.
Okay. So I want to give everybody an opportunity. I am not sure. I don't see another April in the computer part, but April Villani, if you are on the phone, if you could hit *6 and let me know that you're here. All All right, I will check again. I want to give all of us a chance to speak. Again, I want to be respectful of everybody's time, but I know that I don't have a ton to say, but I would at least like to address a couple issues and let people know where I stand and why I'm going to vote the way I'm going to vote. So I want to give everybody that same opportunity. So I guess I will start with Amy, since you made the motion.
Sure. I'll try to go as briefly as I can. Andy, I appreciate you taking the time to read my extremely long written statement that I provided for the last meeting, so I'm just going to hit on the high points. I think consistency with the schedule is key. This bouncing back and forth of, oh, we have a case, so we're going to close for 2 days, and then we're going to go hybrid, and then we're going to close. That's bad news for everybody. So I think consistency is really important. I trust and respect the judgment and advice of the nurses and principals. And of course, their advice is that we do this, that we go remote for this period of time. I believe that we are acting on neutral information. I think we have facts before us involving the quarantine numbers and the numbers of positive cases amongst students and teachers, as well as the trend of those numbers increasing. I totally acknowledge that in so many ways, remote education just really is far less than ideal. It's very hard for working parents, for families with parents who work outside of the home. It's also very hard for families with parents who are working from home still, which is my personal situation. And it does not create the kind of learning that is unreproducible in a face-to-face environment. On the flip side, however, I am concerned about the neediest of our students. And with this system, the neediest students can go to the school building to receive services face to face. And I think that's a critically important point, because in the scenario where we say hybrid and there's a school closure, that school is completely closed. If there is a student with a special education requirement or another special need, they cannot go to the school building to receive those services. But under this setup where we're proactively closing, they can. And I think that's really, really important. I'll leave it at that. I hope that, you know, I'm hoping to persuade the rest of my board mates to vote in favor of this motion. Thank you.
Thanks. I will go to Ann. I hope you're still with us.
Yes, thank you, Andy. I am able to stay just for a few more minutes. I did tell my other meeting and I will be late. So my situation is, the reason why I voted on the 17th is to keep the kids at least remote, is because the guidance we're getting from the governor. As Karen said earlier, you know, we're looking for guidance. Nunu and also Dr. Chan has both said that. But I have a question to my board members, is that if we close these schools to go full remote, and I believe Amy said to the 18th of January, aren't we just moving these situations from them being in the school to now we have the same amount of children in daycare? So how are we going about relieving the situation of these children getting exposed, and also staff? So if we're moving them out of the schools, we're moving them into daycare centers. So either way, these kids should be in school. I would like to know also how we are teaching a child how to write. If they cannot even hold a pencil, how can we teach them that remote? If a child can't read, how are we teaching that child remote? Thank you.
Thanks. Jean?
I think I said enough last week about how I feel about this, but I will reiterate that the situation has changed a little bit. We're charged with educating the kids safely and caring for their well-being. And I know the numbers for children are very low. And I guess my biggest concern is that we have teachers on hand to teach those children. We all have differing opinions on this epidemic, but given the numbers that we're seeing as far as staff, are we going to be able to deliver any education whatsoever if this keeps continuing? We also have to be concerned with the fact that we've seen it so far that parents have not been honest. They're not completing their screening. And that puts everybody, not just the students, but that puts the staff in jeopardy, as well as the whole web of that student's life, parents, grandparents, siblings, whatever the case may be. So, moving forward, I think that we've come to a point right now where we're at a tipping point. We could say, okay, we'll stay in hybrid, come back, people travel, they send their kids to school, kids are sick, more staff is out. Now nobody's getting education, everybody's sick, and this way, like Amy said, it is less than ideal. These kids should be in a school building. They should be learning to hold a pencil. But if we don't have the staff to provide that education to them, then we're being remiss in our duties. Going remote allows us to have some semblance of an education at this point in the climate we're in right now. So I think at this point in time that I would have to look at. I was actually going to consider a different motion than Amy, but given the numbers that we saw today, I don't think that motion is relevant, and I'll hold it back. It was something similar, a little bit different, but anyway, I think we should be going remote right now to preserve our staff, get those staff members that are either quarantined or have COVID back into the mix, and move forward as best we can at this point in time with the guidelines and regulations that we as a school board and as a school district have to follow.
Thanks, Gene. One more check to see if April happens to be on the phone. Okay. I guess I'll give my 2 cents. I'm going to try to keep this brief. My mind's a little scattered. I guess I first want to say I received a lot of emails again this week, like we always do, but a lot more long, well thought out emails than I typically do. And I, without identifying people or being inappropriate in any way, I think you'll know who you are. A couple of folks that are definitely on the other side of this issue from where I am reached out, and I thought that they were respectful, well thought out conversations. And I replied in kind with very long emails to let those folks know where I stand. I think that's where we need to be. We need to understand not everybody's going to be happy with any decision. We need to keep things respectful. Again, without any identifying statements, a board member shared with me today a communication they received from a member of the community that I would 100% classify as a threat. That's not where we need to be. So that being said, I wanted to address a couple quick issues. So everybody kind of knows where I'm coming from. The name of the game for me on this has been and remains consistency. I believe that consistency is key to an education. I believe the ability to plan and know what's coming tomorrow gives our kids and our teachers an advantage. So that's why I support going remote for the next few weeks. I also want to note that I've said, Patty has said, most of the board members have said, the teachers have said, the administration has said, the nurses have said, DOE has said, everybody has said multiple times, we really do want to be back in the buildings. I think that's getting stale at this point, but I wanted to remind everybody that, at least from my personal perspective, because I don't want to speak for anybody else, that is 100% the God's honest truth. My life as a father will be much improved if my kids can go back to school. My life as a board member will be dramatically improved when we can get back to normal. If there, and I'm not saying there is, but if there is anybody listening in the 224 people on this call that has any notion that going remote or hybrid for that matter is easier for anybody, that any of these teachers are doing it so that they can work from their couch, or that in any other way people are doing this to somehow like be lazy or something, let me disabuse you of that notion. This is every single thing is hard on everybody in a different way. I will admit I am probably a bit more privileged than most. I'm a state worker. My agency has told me I'm going to be working from home at least through into March. So I have the ability to be home with my kids. I understand not everybody's in that position. I feel very lucky, very blessed, whatever you want to call it. I do believe in Pembroke. I do believe that, I mean, I've had neighbors check on me and make sure that my kids are cared for and ask if I need any help. And I hope that that's happening all over this community. But when push comes to shove, I never thought, and I think all the board members would agree, I never thought I'd be in a position on the school board where I would have to make any decision that had to do with the health and safety of more than one of our students at a time. It's nuts. I'm not a healthcare professional. I am trying to listen to the experts. I'll be blunt. This is maybe not something I should say in public, but I will. When Governor Sununu says that we should all be back in school, I don't take that to weigh a lot on me. His office was not willing to give us meaningful guidance at the end of the summer. And in his term, honestly, I feel that he has funneled some money from public schools towards private schools. I don't think he's a huge supporter of education. That being said, I also don't think his motivations are completely impure. I think he's trying to protect the economy by rushing people back into school. That is not an unnoble thing. The economy of this state is not as good as it was, and people need to get back to work to make that happen. So I understand where he's coming from, I think. But I'm not putting the economy first. In my mind, it's my job to put the health, safety, and education of our students first, and that's not the same thing. So when I say I'm listening to the experts, I am forced to listen to the experts in the Pembroke School District. This is not a state issue right now. It's not a national issue right now for us. Deerfield has had very few cases. Epsom has been full in, and they're doing well. They have not had a whole lot of days where they were pulled out. That is simply not the case in Pembroke. As one of the callers said, once a day, sometimes twice a day, we are getting more and more and more positive cases. We are down custodial staff. So I'm not even sure that we're able to sanitize overnight the way that we're supposed to, according to the guidelines. I'm not willing to be flexible on the social distancing. Even going down to 3 feet to me is being flexible with health and safety, and that's not an issue I like to be flexible in. So to me, this right now is a Pembroke issue. And we as taxpayers pay a lot of people a lot of money to be superintendents, to be principals, to be teachers, to be nurses, and to run these schools for us. And I would be remiss if I said I distrust all of those people. Again, I don't know what motivation they would have to urge this unless they legitimately thought it was in the best interest of our students. It's not helping them in any way other than being more safe. It's not making their life easier. But I guess to wrap this up, because I'm rambling, my goal is to make it as easy as possible for everybody. And the one thing that I think I can control, the one thing that I think this board can control out of this whole mess that we can't control, is consistency. So I will vote in favor of this motion for the sole fact that it gives our teachers, our students, our families the most time to plan. I wish it would have happened last week so they had another week to plan, but I just want people to know what's on the horizon for the next month or so. I don't, if I had any ounce of confidence that we could be hybrid or full in for that matter, and we wouldn't just get closed down every other day anyway, I'd be all over it. When I say I wish we could be back to normal, I genuinely mean that. But we have been hybrid, so we've basically been at half capacity, and we still have not been able to keep our school doors open. So I don't see how that's going to improve. The numbers are rising, not falling. So for that reason, I will vote in favor of this motion for now.
Hey, this is Ann. Can we move it to vote?
Absolutely. I do want to make one note that I just want to say I recognize that April's not here. That's unfortunate. We've tried to contact her multiple times. If she reaches out to me and asks us to have another meeting in this, I will strongly consider that. I'll reach out for everybody's schedule again. I wish she was here. I wish we could have this with everybody. But since there is no decision right now on what the learning model is after Thanksgiving at all, I do feel like we need some sort of decision to give our superintendent. So with that, I'll call the question, and Ann, I'll let you go first in case you need to jet.
Now, the motion was to go full remote from 11:30 to January 18th. Is that correct?
It was through Friday, January 15th.
Thank you, Amy. I vote no. I feel if that we go full remote, we will not be seeing these students back into the building at all for the rest of the academic year. So I vote no.
Thank you very much. I lost my place. Jean? Thank you, Amy.
Yes.
Thank you, and I'm a yes. So the motion carries. Ann, in case you need to jump off, did you have any last statements or questions before you go? Oh, we might have lost her already. Oh, go ahead.
No. So I guess we can call to adjourn.
I actually wanted to make another motion, but I wanted to make sure that Ann knew that that was my intention. I'd like to make a motion to confirm that principals have the authority to allow staff to work from home during remote, with the exception of staff members who are assigned roles requiring them to be in the school building.
All right, is there a second?
Second.
Okay, I'll call the question so that Ann has the ability to stay here. Ann, go ahead.
I vote no.
Thank you, Jean.
Yes.
Amy?
Yes.
And I'm a yes. Thank you. Thank you for doing that quickly, Amy, so that Ann could stay with us. Ann, do you want to make a motion to adjourn?
Yes, I make a motion to adjourn, and our next meeting is December 1st at
12
6:30. Is that?
That's correct. 12/1 at 6:30. Is there a second?
I'll second.
Thank you. On a roll call vote to adjourn at 6:58. Oh, I'm sorry. Yes, you're
discussion, but I did just want to say, because I've received some of these questions, I have these questions myself, and I just wanted to put on the table of the superintendent and the principals for them to make sure that they are carefully considering and planning and answering questions such as, will cohorts continue during the remote period? Will there be any changes to Mondays? Will the daily schedule of how long classes last, will that change? The extent of synchronous versus asynchronous. We are putting all of that on the table of the administrators and the teachers to carefully consider and decide based on their expertise.
Thanks. So to adjourn at 6:59, Ann? We might have lost her. Ann, you still with us? Okay, Amy?
Yes.
Jean?
Yes.
And I'm a yes. Thanks everybody for joining us. Sorry to rush it, and have a great week. See you on 12/1.
Happy Thanksgiving.
You can send that to me, please?
Yes. Yes, I will. I'll do it right now.
And the last part.